Hello everyone, my name is Dr. Asma Zafar and I'm back with an exciting new topic of research. Today's topic of research is genetics and oral health. Basically, genes are the blueprints of humans and genetics plays a key role in the etiology of many diseases. On top of all the oral health issues that we encounter in our daily lives, the topmost is the dental caries, which is a huge concern for the major part of world's population. It could be caused as a result of environmental factors or host-related factors. The environmental factors include diet, oral hygiene, the levels of fluoride or the levels of bacteria in the oral cavity, while the host-related factors include the salivary flow or the salivary buffering capacity. A study also proposed that the vulnerability or the protection from the caries could be as a consequence of one genotypic, one phenotypic, and one environmental impact. Several other studies also suggested the role of inherited components in the etiology of caries. Furthermore, the inherited disorders of the tooth, salivary stream, or immune disorders could additionally impact the incidence of dental caries. Hence, this suggests a clear evidence of genetic component controlling the development of caries at various aspects such as gender, salivary, immunological, and surface heritability. Now let's talk about the role of genetics in periodontitis. Normally, periodontitis is seen as a multifactorial infection where the harmony between the host reaction and the microbial plaque is disturbed. This interruption can happen as a result of changes in the plaque composition or host reaction, or natural and behavioral impacts that influence both plaque and host reactions. A number of studies conducted in the past have also suggested that approximately half of the variance of the disease in the population is attributed to genetic variants. Hence, the basis for heritability of periodontitis appears to be biological and not behavioral in nature. And now let's discuss the genetics and malocclusion. Orthodontics is the field which comes to the rescue when it comes to malocclusion. A significant amount of data exists which shows that genetics plays a prominent role in malocclusion. It is also suggested that the greater the genetic component, the worse is the prognosis for the orthodontic intervention. The difficulty, of course, is that it is seldom possible to determine the precise contribution of hereditary and environmental factors in a particular case. Now comes the genetics and oral cancers. This one is particularly easier to understand since all the cancers overall are caused as a result of some changes in the genetic makeup of cells. So hereditary instability in the oral cancers could be as a result of mutations in the proto-oncogene or transformations in the tumor suppressor gene. There are several cancer predisposition syndromes which includes Werner syndrome, Bloom syndrome, Fanconi syndrome, or disorders like ataxia, telangiectasia. Other genetic oral disorders consist of cleft lip and palate, ectodermal dysplasia, or oligodontia, also known as hypodontia. And now comes the big question mark. What can we do in such cases, or if there is something that could be done in such cases? Well, for this purpose, various health promotional measures have been undertaken like genetic screening or genetic counseling. Visiting your dentist twice a year for regular checkups can help them to identify any genetic disorders that you might have that might affect your oral health. Beyond your dental visits, you could actually keep up with the factors that you can control. For example, having a good oral hygiene to maintain the best oral health. Thank you so much. That was it for today. See you another day.